I'm about to show you something that sounds impossible. A kitchen ingredient that costs about $2, sitting in your pantry right now, that can lift years of stains off your teeth without a single whitening strip, without a whitening pen, without a single trip to a dentist chair. Coffee stains, tea stains, red wine stains, the yellow film that builds up on your enamel over years of everyday eating, all of it starts lifting within days. And your enamel doesn't get damaged in the process, not if you do it the right way. This isn't some fantasy. This isn't clickbait. This is basic chemistry sitting in your cupboard. And once you understand why it works, you'll wonder why nobody explained it to you properly before. Actually, you won't wonder. You'll know exactly why. Because the teeth whitening industry makes billions of dollars every single year selling you strips, gels, pens, and in-office treatments that all lean on the same basic principle this $2 ingredient uses for a fraction of the price. The ingredient I'm talking about is sitting in your kitchen cabinet right now. You've probably used it in a recipe last month without ever thinking about what it could do for your smile. But before I tell you exactly how to use it, I need to explain something. Because if you skip this part and just start scrubbing your teeth with it every single day, you could actually damage your enamel. And I don't want that. I want you to understand what's happening first. Because once you do, you'll never waste money on whitening kits again. Let's talk about tooth stains for a second. Why are they so stubborn? The problem isn't lifting colour off a surface. Plenty of things can scrub colour off a surface. Sandpaper lifts colour. Bleach lifts colour. Harsh acids lift colour. You could take something abrasive enough and scrub your teeth raw, and technically the surface would look different. The problem is lifting stains without wearing down the enamel underneath. That's the real challenge. That's what makes safe, effective whitening so difficult and so expensive to package and sell. See, most whitening products work in one of two ways. They either use peroxide-based bleaching agents that break down stain molecules chemically, which is what strips, pens, and professional treatments rely on, or they use mild abrasives that physically buff surface stains away, which is what most whitening toothpastes are quietly built around. Peroxide products work, but a box of strips runs you $20 to $50 and lasts maybe 2 weeks before you're buying another box. Professional in-office whitening can run anywhere from $300 to $800 for a single session. The whitening toothpaste industry, meanwhile, has spent decades convincing you that you need their specific tube, their specific formula, their specific blue gel that activates with LED light you also have to buy. But there's a third option, an option that's been sitting in kitchens for over a century, an option old-school dentists have quietly recommended to patients for decades before the whitening industry existed in its current form. An option that costs pennies per use and relies on a substance your grandmother probably had in her cupboard the entire time. It's called sodium bicarbonate. You know it as baking soda. Same white powder you use to make cookies rise, deodorize your fridge, or put out a small grease fire. Same cheap, mildly abrasive, stain-lifting powder that's been hiding in plain sight the whole time. Here's how it works, and this is the part that changes how you think about it once you actually understand it. Baking soda does two things simultaneously when you use it correctly. Thing one, it's a very fine, very mild abrasive. Under a microscope, baking soda crystals are soft and small compared to the abrasive particles used in a lot of commercial toothpaste. When you brush gently with a baking soda paste, those soft crystals physically loosen and lift surface stains sitting on top of the enamel, the coffee film, the tea residue, the surface pigment from food and drink that builds up day after day. It's polishing, not scraping, when it's done properly and not overdone. Thing two, baking soda is highly alkaline. Your mouth naturally becomes acidic after you eat or drink anything, especially coffee, soda, or wine. And that acidic environment is exactly what allows stains to bind to your enamel and what allows bacteria to thrive. Baking soda neutralizes that acid on contact. It raises the pH in your mouth almost instantly, which makes it much harder for new surface stains to set and for the bacteria that contribute to plaque buildup to multiply. So while the mild abrasion is lifting what's already there, The alkaline environment is making it harder for new stains to take hold. This is not a hack. This is not a gimmick. This is basic dental chemistry that's been documented for decades. Enamel and surface stain molecules respond to gentle abrasion and pH change in very different, very predictable ways, and baking soda sits right in the sweet spot of being enough to lift the stain without being harsh enough to gouge the enamel, as long as you don't overdo it. Now you might be thinking, if this is so effective and so cheap, why doesn't every dentist just hand out boxes of baking soda instead of selling whitening kits? And the answer is the same answer it almost always is: money. There's no profit margin in a box of baking soda that costs $2 or $3 and lasts for months. You can't build a multi-billion-dollar whitening industry on an ingredient people already own and only need a small amount of. The money is in the branded strips, the subscription whitening pens, the in-office sessions that cost hundreds of dollars and have you coming back every few months when the effect fades. Baking soda doesn't need a marketing budget. It just works, quietly, the way it always has. If you're watching this and you've spent $40, $60, even $100 on whitening strips and pens over the last year and your teeth still look dull in photos, this is exactly why. You've been buying an expensive solution to a problem that a $2 box in your kitchen can handle for the surface staining part. Drop a comment telling me what's staining your teeth the most right now: coffee, red wine, tea, or just years of build-up. I want to know what you're dealing with. Okay, let's talk application, because the ratio and the technique matter here just as much as they do with anything else you put in your mouth. Get this wrong and you could either see no results or, worse, wear down your enamel over time. The formula: half a teaspoon of baking soda mixed with just enough water to form a thick paste, roughly a few drops, stirred until it's the consistency of toothpaste, not runny, not chalky and dry, somewhere in between. That's it. Half a teaspoon, a few drops of water. Dip your toothbrush into the paste, a soft bristled brush, never a medium or hard bristled one for this. Brush gently in small circular motions for about 2 minutes, the same amount of time you'd normally brush, paying slightly more attention to the areas where staining is heaviest, usually the front teeth and along the gum line. Do not scrub hard. Do not press down like you're trying to sand something. Gentle, circular, patient pressure is the entire technique. Rinse thoroughly with water afterward. Some people like to follow it with a regular fluoride toothpaste brush right after, which is completely fine and actually a good habit, since baking soda alone doesn't contain fluoride to help mineralize enamel. Timing matters here too. Use this in the evening or morning as part of your normal brushing routine, not as some extra scrubbing session on top of your regular brushing. And here is the critical rule, the one people skip and then wonder why their gums feel raw. Do not do this every single day. 2 to 3 times a week is the safe, effective range. Baking soda paste used daily, week after week, is where people run into trouble, because even a mild abrasive used constantly, day in and day out, can gradually wear down enamel over months and years. Used 2 or 3 times a week, it gives your enamel time to recover and your stains time to lift gradually without the wear building up. Within a few uses, you'll start noticing the difference. Surface stains from coffee and tea begin looking lighter, less dull, less yellow along the edges. By 2 to 3 weeks of consistent, moderate use, most people notice a visibly brighter smile in photos and in the mirror, not the blinding white you'd get from a professional bleaching treatment, but a real, noticeable lift in the surface staining that was making your teeth look duller than they actually are underneath. And your gums, if you're gentle, should feel completely normal, not sore, not irritated. If you ever feel soreness or sensitivity, that's your body telling you to back off the frequency, not push through it. Let me talk about what baking soda does not do, because I'd rather be straightforward with you than have you disappointed. Baking soda is effective against surface staining, coffee film, tea residue, surface wine pigment, general yellowing from years of food and drink sitting on top of your enamel. It lifts that kind of surface discoloration well. It does not change the actual colour of your dentine, the layer underneath your enamel, and it does not fix deep intrinsic stains, the kind caused by certain medications taken during childhood, by fluorosis, by old dental work, or by genetics. If your teeth are naturally more yellow or grey at the root of the tooth itself rather than on the surface, no surface treatment, baking soda or otherwise, is going to change that, and that's a conversation for an actual dentist, not a kitchen ingredient. If your main issue is that kind of deep internal discoloration, baking soda alone won't solve it. But if your issue is surface staining from coffee, tea, wine, or just general daily build-up, this is one of the simplest tools you have. Now let me give you some warnings, because I want this to actually help you, and I want you to do it safely. Warning 1, do not use this daily, long-term, without breaks. I already mentioned this, but it's worth repeating because it's the single most important rule here. 2 to 3 times a week, not every day. Consistency over time matters more than frequency. Warning. 2. If you have braces, retainers, veneers, crowns, or any kind of dental restoration on your front teeth, talk to your dentist before trying this. Baking soda can affect different surfaces differently, and porcelain or composite restorations don't always respond to abrasives the same way natural enamel does. Warning 3. If you already have sensitive teeth, receding gums, or thinning enamel from previous overbrushing or acid erosion, be extra cautious, use it less frequently, or skip it and talk to your dentist about gentler alternatives. Warning 4. Never combine this with harsh acidic ingredients like straight lemon juice or vinegar in an attempt to boost the effect. Some people online suggest mixing baking soda with lemon juice for a stronger whitening paste, and that combination is actually one of the worst things you can do for your enamel, because the acid softens the enamel surface right before you scrub it, which dramatically increases the erosion risk. Baking soda and plain water only. Warning 5. This is not a substitute for regular dental checkups and professional cleanings. Surface staining and plaque buildup are different things, and a dentist can catch issues a mirror at home never will. Let me also address the questions I know are coming in the comments before you even ask them, because I've seen these same questions under every video like this one. Does it matter what kind of baking soda you use? Not really. Plain sodium bicarbonate, the same box you'd buy for baking or for the fridge, is exactly what you want. You do not need a special cosmetic-grade baking soda, and you don't need to pay extra for a version marketed specifically for teeth. It's the same compound in every box, whether it costs $1 or $5, so buy whichever one is cheapest at your grocery store. Can you use an electric toothbrush with the paste instead of a manual brush? You can, but be even more careful with the pressure, because electric brushes already apply consistent motion and pressure on their own, and combining that with an abrasive paste and heavy hand pressure is exactly how people accidentally overdo it. If you use an electric brush, let the brush do the work, keep the pressure light, and stick to the same 2 to 3 times a week frequency. What about mixing it with hydrogen peroxide instead of water? This is where you need to be careful with proportions rather than avoiding it outright. A small amount of food-grade, low-concentration hydrogen peroxide, the 3% kind sold at any pharmacy, mixed with baking soda to form a paste, is something some dentists have historically mentioned as an at-home option, since the peroxide adds a mild chemical whitening effect on top of the physical polishing. But the concentration matters enormously, and using anything stronger than the 3% solution sold over the counter, or using it more frequently than the baking soda paste alone, significantly raises the risk of irritating your gums and softening enamel. If you're not confident about measuring this correctly, the plain water version is the safer starting point, and you can ask a dentist directly about the peroxide version if you want to explore it further. Is it normal for it to taste salty and slightly unpleasant? Yes. Baking soda doesn't taste like mint toothpaste, and that's fine. Some people rinse with a small amount of regular toothpaste afterward just to get a fresher taste and the fluoride benefit, and that's a completely reasonable thing to do. How long before you should expect to see a difference? Everyone's staining is different, so there's no single guaranteed timeline, but most people who use it consistently, 2 to 3 times a week, gently, Start noticing a visible lightening of surface stains somewhere between the second and third week. If you've seen zero change after a full month of consistent, correct use, that's a sign your staining may be deeper than a surface treatment can address, and that's the point where a conversation with a dentist makes more sense than continuing to experiment on your own. Here's a simple weekly structure you can follow if you want a routine rather than guessing. Monday, regular brushing with your normal toothpaste, morning and night. Wednesday, swap your morning brush for the baking soda paste instead of your regular toothpaste, then brush again that evening with your regular toothpaste. Friday or Saturday, repeat the baking soda paste once, morning or evening, whichever fits your schedule better. That's 2 applications a week, spaced out, which sits comfortably inside the safe range while still being frequent enough to see steady progress over a few weeks. If you want to push slightly harder during a specific week, say before an event or a set of photos you care about, 3 times that single week is still within the safe ceiling, but don't make 3 times a week your permanent baseline going forward. Let's also do a quick recap of what to do and what to avoid, because I'd rather you walk away from this video with a short, clear checklist than a long list of details you have to remember perfectly. Do use half a teaspoon of baking soda mixed with a few drops of plain water to form a thick paste. Do brush gently in small circles with a soft bristled brush for about 2 minutes. Do limit yourself to 2 to 3 times a week. Do follow up with your regular fluoride toothpaste afterward. Do rinse thoroughly with water when you're finished. Do not brush hard or scrub like you're trying to remove a stain from a countertop. Do not use it every single day, week after week, with no break. Do not mix it with lemon juice, vinegar, or any acidic ingredient. Do not use it if you have untreated gum disease, exposed roots, or significant enamel erosion without talking to a dentist first. Do not expect it to change stains that come from underneath the enamel rather than sitting on top of it. Picture this. Someone spends years drinking 2 cups of coffee every morning and a glass of red wine most evenings, and over time their teeth go from a normal white to a dull yellowish grey, especially along the front teeth where the staining shows up first in every photo. They try a box of whitening strips from the pharmacy, $40, 2 weeks of use, mild sensitivity the whole time, and the result is only a slight difference that fades again within a couple of months. They try a whitening toothpaste that promises results in 2 weeks, another $10, and notice almost nothing different after finishing the tube. Frustrated, they finally try the baking soda paste, half a teaspoon, a few drops of water, twice a week, gentle circular brushing, nothing fancy. Within the first week, the coffee stains along the front teeth start looking less heavy. By 3 weeks, in photos taken in the same lighting as before, the difference is clearly visible. Not a Hollywood white, but a real, noticeable brightening. The dullness gone, the yellow tint faded significantly. Total cost, a fraction of a $2 box of baking soda they already had in the pantry for baking. That's the entire story, repeated in some version in comment sections, under videos like this one every single week. Real people, kitchen ingredient, patience, and gentle technique versus $40 and $50 products that promise more than they consistently deliver. One more thing before I let you go, and I think this might be the most important point in this entire video. Baking soda lifts existing surface stains, but it doesn't prevent new ones from forming. If you drink coffee every morning and red wine every evening, new surface staining will keep happening regardless of how well you clean your teeth, because that's just how pigmented drinks and enamel interact over time. Baking soda handles what's already there. To slow down new staining, you need a broader daily habit, rinsing your mouth with water right after coffee or wine, not brushing immediately after acidic drinks, since your enamel is temporarily softer right after, and keeping up with regular brushing and flossing so plaque doesn't give new stains something to cling to. And that's really the bigger picture here. Layer by layer, habit by habit, a routine that costs almost nothing and does more for your smile than a drawer full of half-used whitening kits ever did. If you found this useful, let me know in the comments what stains you're dealing with the most, and I'll tell you honestly whether baking soda is the right first step or whether it's something better left to an actual dental visit. This video is for educational and informational purposes only. It reflects my own personal opinions and observations based on things I've come across on YouTube, Google, and various news sources, and it is not medical, dental, or professional advice of any kind. I'm not a dentist or any kind of licensed professional, and nothing in this video should be taken as a diagnosis, treatment plan, or a substitute for advice from a qualified dental professional. Everyone's teeth, gums, and enamel are different, and what works for one person may not be appropriate for another. Please consult a licensed dentist before trying any new dental care routine, especially if you have existing dental work, sensitive teeth, gum issues, or any other oral health concerns. Individual results vary, and nothing shown or described here is guaranteed to work the same way for every person, every set of teeth, or every type of staining. Use this information as a starting point for your own research and for a conversation with a qualified professional, not as a final answer on its own.